That moment when you look in the mirror and your skin feels subtly unfamiliar, drier than usual perhaps, or you notice a new fragility you haven't seen before. It's an awareness that something fundamental has shifted, a shift that transcends typical seasonal dryness or aging. What we're really tuning into is the profound, intricate relationship between your body's hormones and your skin's health. In today's discussion, we are going deep into one of the most significant changes women experience: the characteristic shifts in the skin, hair, and nails that signal declining estrogen levels, often associated with the transition into and through menopause. We are going to move past the surface-level descriptions and explore the complex biological mechanisms at play. This isn't just about appearance, it's about structure, function, and resilience. By understanding the role of this vital hormone, we gain the knowledge we need to care for our skin in the most effective ways possible during this life stage. Estrogen is famous, of course, for its role in the reproductive system, but to simplify it as merely a female sex hormone completely underestimates its reach. Think of it more as a master regulator, a crucial signaling molecule that influences everything from bone density to heart health. And critically, for our topic, the skin is actually a major target for estrogen. It is often referred to as an estrogen-responsive organ. The skin is equipped with specific docking stations for estrogen, known as estrogen receptors, primarily ER-alpha and ER-beta, which are found on virtually every major cell type within the skin. They are on the keratinocytes that form the protective surface, the fibroblasts that produce structural components, and even the melanocytes that determine pigment. When estrogen binds to these receptors, it triggers a cascade of genetic and non-genetic actions that maintain skin thickness, elasticity, and hydration. During a woman's reproductive years, the ovaries are the powerful central factory for estrogen production, sending out a robust signal to the entire body. However, the skin is also a sophisticated, local producer of estrogen. This local production happens through an enzyme called aromatase, which converts precursor hormones, like androgens, directly into estrogen within the skin tissue. This local creation is a crucial internal defense mechanism, working like a small, self-regulating guard station. Menopause, defined by the World Health Organization as 12 consecutive months without a menstrual period, signals the failure of the ovary to produce that high-level estrogen signal. The ovaries essentially retire from the hormone-producing business. At this point, the entire body, including the skin, becomes reliant on these smaller, peripheral sources of estrogen. It's a huge drop in signaling power, and the skin begins to show the cumulative effects of a long-term systemic deficiency. The decline in estrogen profoundly impacts the structural support system of the skin, which we call the dermis. This is where the skin's strength and flexibility reside. The loss of structural integrity, collagen and elastin. When we discuss skin aging, the spotlight is often on collagen, and for good reason. Collagen is the most abundant protein in the body, providing the scaffold that keeps skin firm. Estrogen is a potent stimulator of fibroblast activity, signaling these cells to churn out fresh collagen, particularly the strengthening types like type 1 and type 3. As estrogen levels plummet, this signaling dramatically weakens. Research shows that women can experience a swift and significant loss of dermal collagen in the initial years immediately following menopause. This is far more accelerated than the typical 1% annual loss we experience as part of chronological aging. This rapid depletion leads to a loss of underlying structural support, which inevitably manifests as increased skin laxity and the formation of fine lines and wrinkles. But it's not just collagen. Elastin, the protein that gives skin its stretch and recoil, is also compromised. Estrogen helps maintain the integrity of the elastic fiber network. Without its protective influence, this network starts to fragment and become disorganized, a process known as solar elastosis, which is accelerated by sun exposure. The tangible result is that loss of snap recoil. If you pinch the skin on your hand, it takes noticeably longer to smooth back out than it did 10 or 15 years prior. This is a telltale sign of a compromised dermal matrix. changes in the epidermis and hydration. Moving up to the skin surface, the thinning of the epidermis is another critical characteristic change. The epidermis is the protective layer comprised mostly of keratinocytes. Estrogen supports the vitality and turnover of these cells. A decline in the hormone leads to a reduction in the number of active keratinocytes, causing the entire outer layer to become visibly thinner. This thinning contributes to the overall fragility of the skin and also affects its ability to reflect light, often resulting in a duller or more sallow complexion. Hand in hand with this is the dramatic loss of hydration. This is a two-pronged problem affecting both the dermis and the epidermis. In the dermis, estrogen stimulates the production of vital water-binding molecules called glycosaminoglycans, GAGs, the most famous of which is hyaluronic acid. These molecules act like internal sponges, drawing water into the dermis and maintaining skin turgor and plumpness. With less estrogen, GAG production declines sharply, meaning the skin loses its capacity to hold onto internal moisture, leading to a deep, underlying dryness that no surface moisturizer can fully address alone. In the epidermis, the protective skin barrier is compromised. This barrier is a complex structure of lipid molecules, ceramides, cholesterol, and fatty acids that are layered like bricks and mortar to prevent excessive transepidermal water loss. Estrogen supports the synthesis of these barrier lipids. When the production wanes, the barrier becomes compromised, leading to increased water evaporation and a sensation of uncomfortable, persistent dryness. This weakened barrier also becomes more permeable, allowing irritating substances and allergens to penetrate the skin more easily, increasing the likelihood of redness, sensitivity, and contact irritation. Impairment of functional processes, wound healing, and vascularity. The role of estrogen in skin function is perhaps most vividly demonstrated in its effect on wound healing. This is not just a cosmetic issue, it's a fundamental biological necessity. Estrogen is directly involved in orchestrating all three phases of wound healing. Inflammatory phase. It modulates the immune cells, such as macrophages, to clear debris efficiently. Proliferative phase. It stimulates the production of growth factors, like vascular endothelial growth factor, VEGF, which are essential for creating new healthy tissue. Remodeling phase. It guides the quality and organization of the new collagen being laid down. When estrogen is deficient, this complex coordination slows down significantly. Healing becomes less robust, taking longer for cuts, scrapes, or surgical incisions to close and fully repair. Experts agree that this prolonged healing phase increases the vulnerability to infection and can potentially lead to more noticeable scarring. Taking extra meticulous care of any skin injury becomes non-negotiable at this stage of life. Another major functional change is in vascularity and microcirculation. Estrogen helps to maintain the health, elasticity, and strength of the blood vessel walls. As levels decline, the quality and integrity of the microvessels in the skin are diminished. They become more fragile and less supported by surrounding tissue. This makes the vessels leaky and highly susceptible to rupture from minor trauma, directly explaining why bruising, especially on thin-skinned areas like the backs of the hands and forearms, becomes much more common and slower to resolve. This reduced quality of blood flow also means a less efficient delivery of oxygen and essential growth factors to the skin cells, slowing down the overall metabolism and repair processes. Increased vulnerability, oxidative stress, and sun damage. We mentioned the cytoprotective effect of estrogen, and this deserves a closer look. Estrogen acts as a powerful endogenous antioxidant. Throughout the day, our skin is bombarded by environmental stressors, most notably ultraviolet radiation from the sun, but also pollution and infrared radiation, which generate reactive oxygen species or highly damaging free radicals. These free radicals attack and damage the DNA, lipids, and proteins, like collagen, in our skin cells, initiating an inflammatory cascade. In its role as a natural shield, estrogen helps quench these free radicals, mitigating the damage. With the loss of this essential defense mechanism, the skin becomes significantly more vulnerable. This state often leads to chronic, low-grade inflammation, a phenomenon sometimes referred to as inflammaging. It means that every minute of sun exposure, every environmental challenge does more damage, and the skin's ability to bounce back and repair its DNA is significantly compromised. This lack of protection dramatically accelerates photoaging changes like hyperpigmentation and deep wrinkling. Diligent sun protection moves from being a good idea to being a critical health necessity for estrogen-deficient skin. Skin texture issues and androgen effects. The shifting hormonal balance can also manifest in specific texture issues. While estrogen declines, the relative influence of androgens, like testosterone, can sometimes become more pronounced. This relative androgen excess can lead to the stimulation of oil glands, causing a recurrence of adult acne or hormonal breakouts, even in women who haven't experienced them for decades. This is often characterized by deeper cystic lesions concentrated around the chin and jawline. Furthermore, the integrity of the supportive tissue around pores declines due to collagen loss. Pores are essentially openings for hair follicles and oil glands. When the surrounding dermal support structures, which are rich in estrogen-dependent collagen, are lost, the pore walls are unable to hold their shape and structure, leading to dilation. This makes the pores appear noticeably enlarged and more prominent, a common visual change during this time. The impact on hair and nails. The structural influence of estrogen extends naturally to the hair and nails, which are, biologically speaking, extensions of the skin structure. Hair thinning and miniaturization. Estrogen plays a key protective role in the hair growth cycle. The hair cycle has three main phases: anagen, growth; catagen, transition; and telogen, resting, shedding. Estrogen is known to prolong the anagen phase, keeping hair on the scalp longer, making hair strands thicker, and supporting density. When this powerful signal is lost, the anagen phase shortens, leading to hair spending more time in the resting phase. Combined with the potential relative increase in androgen influence, this can accelerate a process called follicular miniaturization. The hair follicle shrinks over time, and the resulting hair strand grows progressively shorter, finer, and lighter in color with each cycle. The result is a noticeable decrease in hair density and volume, often presenting as a widening part line or diffuse thinning across the crown, commonly known as female pattern hair loss. Additionally, the individual hair strands themselves become more fragile and brittle due to structural changes, making them more vulnerable to breakage from styling or brushing. Nail fragility. The nail plate is produced by the nail matrix, which is located just under the cuticle. The strength and flexibility of the nail depend on the healthy production of structural proteins, primarily hard keratins, and the surrounding supportive tissues. Just as with collagen, the decline in estrogen affects the production of these key proteins. The resulting nail plate is often weaker, dehydrated, and less flexible. This leads to brittle nail syndrome, medically known as onychoschitzia, characterized by vertical ridging, peeling, and susceptibility to splitting and chipping. The skin surrounding the nail fold, is also drier and more fragile, further impacting the health of the entire nail unit. Proactive and supportive strategies. Understanding these profound structural and functional changes is the first, most powerful step. The second is exploring the range of options available to mitigate these effects. Medical and hormonal interventions. Systemic hormone replacement therapy, HRT. For many women, HRT is the most effective way to address the systemic effects of estrogen deficiency, including the skin. By restoring hormone levels, it provides that critical signal back to the fibroblasts. Clinical studies have shown that HRT can significantly reverse the loss of collagen, improve skin thickness and elasticity, enhance hydration, and even lead to an improvement in hair density and nail strength. However, the decision to use HRT involves a thorough risk-benefit analysis, considering a woman's medical history, and must be made in close consultation with specialists, such as a gynecologist or endocrinologist. Topical estrogen. This approach involves applying estrogen directly to the skin, focusing the benefits locally. Preliminary research suggests topical estrogen creams or gels can be effective in reversing localized skin changes such as fragility, crepiness, and dryness. Because it is a form of hormone therapy, even localized use requires a prescription and oversight from a healthcare provider to ensure safety and appropriateness. Cosmeceuticals and targeted actives. For those who cannot or choose not to pursue hormonal therapy or as a powerful adjunct, topical cosmeceuticals offer targeted support. Phytoestrogens. These botanical compounds found in sources like soy, isoflavones like genistein and digoxin, and flaxseed, lignans, have a chemical structure similar to estrogen and can interact mildly with the skin's estrogen receptors. They are not as potent as prescription hormones, but some research indicates they may offer benefits in improving skin hydration, elasticity, and reducing fine lines, essentially acting as mild, selective estrogen receptor modulators. SERMs on the skin. They can be found in a range of over-the-counter products, but their efficacy can vary widely between formulations. The gold standard, topical retinoids. When addressing the structural decline of estrogen-deficient skin, topical vitamin A derivatives, known as retinoids, are unparalleled. Prescription-strength tretinoin, as well as over-the-counter options like retinol and retinaldehyde, work by communicating with skin cells to normalize the entire aging process. Dermal action. Retinoids are proven to signal fibroblasts to significantly boost procollagen synthesis, helping to rebuild the depleted dermal collagen framework. They can actually reverse some of the dermal thinning. Epidermal action. They normalize and accelerate the turnover of keratinocytes, smoothing out rough texture, enhancing skin radiance, and directly addressing the issue of enlarged pores by keeping them clear and properly structured. This ingredient is a cornerstone of any anti-aging regimen for mature skin, although it requires a commitment to consistency and patience to overcome the initial adjustment period. Alpha hydroxy acids, AHAs. While known for their exfoliating properties, AHAs, particularly lactic acid, have a unique dual function that is highly beneficial for estrogen-deficient skin. At lower concentrations, it acts as a gentle exfoliant. But at concentrations of 12% or higher, studies show lactic acid penetrates the skin to increase the production of those vital dermal glycosaminoglycans, GAGs. This means it helps the skin attract and hold more internal water, effectively increasing the thickness of the skin and improving hydration from within, a crucial countermeasure to the structural dryness caused by hormone decline. Embrace moisturization and barrier repair. This seemingly boring step is foundational. Because the skin's natural barrier is compromised, the moisturizer's job is to substitute for it. Look for formulations rich in barrier-repairing ingredients, ceramides, which replace the lost lipid matrix, humectants like glycerin and hyaluronic acid to draw moisture in, and occlusives like petrolatum or dimethicone to seal it all in and drastically reduce transepidermal water loss. A rich, consistent moisturizing routine is essential to mitigate fragility and dryness. Lifestyle and procedural support. Advanced in-office procedures. To rapidly stimulate collagen production in the deep dermis, certain cosmetic procedures are highly effective. Energy-based devices, radiofrequency, RF, and certain laser treatments like fractional non-ablative lasers use heat or light energy to create controlled micro-injuries deep within the dermis. This controlled damage forces the fibroblasts into a massive emergency repair mode, resulting in a significant production of new, dense collagen and a tightening of the existing fibers. Microneedling. This procedure creates thousands of tiny channels in the skin, which serves two purposes. It allows topical products to penetrate deeper, and the physical act of puncturing the skin is a mechanical signal to the immune system to initiate wound healing, thereby boosting collagen and elastin production. At-home technology, low-level laser therapy, LLLT devices, often using red and near-infrared light, have been shown to work by improving mitochondrial function in the fibroblasts. This enhances the cell's energy production, leading to more robust collagen synthesis. LLLT also possesses anti-inflammatory properties, helping to mitigate the inflammation caused by the loss of estrogen's cytoprotective effect. Additionally, it can help improve microcirculation, enhancing the skin's radiance and supporting better nutrient delivery. Diet and holistic health. Support your skin from the inside out. A diet rich in antioxidants, colorful fruits and vegetables, and healthy fats, omega-3s from fish, nuts, and seeds, helps fight the reactive oxygen species that estrogen is no longer neutralizing effectively. Managing chronic stress is equally vital, as high cortisol levels further degrade collagen and exacerbate the inflammation we are trying to control. Finally, let us return to the most crucial point, which must be the foundation of any care plan: sun protection. For estrogen-deficient, mature skin, UV protection is no longer just about preventing sunburn or new spots. It is about protecting the cellular repair mechanisms that are already running at a deficit. Because the skin's ability to heal and recover from solar-induced damage is significantly impaired, every measure, broad-spectrum SPF 30 or higher, sun-protective clothing, and seeking shade, is necessary to stabilize the current collagen, prevent further accelerated aging, and support all other topical treatments. Without meticulous sun protection, even the most expensive retinoid or powerful HRT cannot fully overcome the continuous, deep-seated structural destruction caused by ultraviolet radiation. The transition marked by declining estrogen is a powerful and natural phase of life, bringing with it a unique set of changes to the skin, hair, and nails. Understanding these shifts on a biological level, from the thinning epidermis and the fragmenting collagen to the compromised barrier and the reduced wound healing, allows us to move away from quick fixes and towards informed, supportive care. By utilizing powerful evidence-based actives like retinoids and AHAs, prioritizing essential barrier protection, and always, without exception, wearing sun protection, you are providing your skin with the tools it needs to thrive. This journey is about knowledgeable self-care and respect for your body's changing landscape. If you found this deep dive helpful in understanding the science behind your skin, I encourage you to share your experiences or questions in the comments below. Your insights are invaluable to this community. We're all learning and adapting together. A simple like and a subscription would be greatly appreciated as well, helping us to continue providing this level of detailed, supportive information. Take this knowledge with you, be gentle with your skin, and always remember to protect it.